You're just a nursing student. Clean the floor.
Angel, is that really you?
You missed a spot. Dr. Ellison said it without lifting his eyes from the chart, one finger extended toward the corner of the supply room, pointing at a 2-inch patch of dried dirt near the base of the shelving unit. He kept writing. The pen didn't pause. He delivered the correction the way someone mentions the weather, informational, carrying no particular weight, requiring no particular response. I looked at the corner. I looked at the mop in my hand. I mopped the corner. Better, he said, and collected the chart under his arm, and walked out of the room without once looking at my face. That was 11 in the morning. I had been at Ridgeview County Memorial for 23 days, and Dr. Walter Ellison had not looked at my face in all of them. I'd verified this. It was the kind of observation I made automatically, a habit installed over years of work that required precise cataloging of who was paying attention to what. The habit had outlasted the work that built it, the way a scar outlasts the wound that made it, functional in its own quiet way, not going anywhere. I returned the mop to the closet. I ran cold water over my wrists at the utility sink until my pulse settled back below 60. I stood there until the number I needed was the number I had. Ridgeview County Memorial was a 12-bed critical access hospital pressed into the Blue Ridge foothills of western Maryland like something set down by accident and never retrieved. One attending physician, 2 full-time registered nurses, a rotating roster of students from Allegheny State doing their third-year clinical hours before moving on to wherever they were going next. I was the current one, 3 weeks and 2 days in, and nobody at this hospital had retained my name. "You're the student from Allegheny," Renee had said on the first morning. Renee was 54, 17 years running this floor, long past being surprised by anything it produced. "Sadie Marlowe," I'd answered. She'd checked the name against my badge, nodded once, and handed me a printed supply checklist to complete before the morning briefing. That exchange had set the terms of everything that followed, and I hadn't tried to renegotiate any of it. I was 31 years old, light brown hair cut short, just touching my jaw, green eyes that read gray under fluorescent light, which I'd decided was an acceptable trade. 5'5", compact in the way of someone whose body had spent years being reliable rather than noticed. My scrubs were 2 sizes too large, purchased that way on purpose. The extra fabric at my right sleeve covered a scar that ran the outer wrist toward the elbow, thin and diagonal, 7 centimeters, white against paler skin. The loose neckline covered the other one, the one at my left shoulder. The general shapelessness of the whole outfit covered everything else that 3 years of attempting ordinary hadn't quite managed to hide. I'd built this version of myself with the same methodical patience I'd once applied to considerably more technical problems. Quiet, forgettable, responsive without being present. Moving through rooms without disturbing them was something I'd practiced until it became automatic. My voice stayed at a register low enough that people who weren't interested in paying attention simply missed what I said, and that was usually fine. A neutral expression, held with the discipline of someone who understands the face, is the first thing people read and the last thing you can afford to leave unmanaged. I'd been trained by people for whom unremarkable was a professional survival requirement. The training had outlasted everything else. Dr. Ellison addressed the female staff by first name. He addressed the male radiology technician as Dr. Marsh. He'd referred to every nursing student who'd ever rotated through this floor as student, without exception, and he'd supervised a considerable number of them. "Student, bring me the chart for Bay 3. Student, room 4 is overdue for afternoon vitals." I responded every time. Chart retrieved. Vitals taken. Correcting him would have required engagement, and engagement required a presence I wasn't here to establish. So I absorbed the designation with the same practiced equanimity I applied to everything else, and I didn't correct him. It was a good plan. I was good at plans. At 2 in the afternoon, Renee caught me in the corridor outside the medication room. "Room 7, Mr. Doyle. Afternoon vitals." He knocked over his water again. "On my way," I said. The hallway to room 7 passed the nurse's station, a bulletin board, a consultation room with a persistently flickering light, and ended at a door that was always left half open because the man inside preferred it that way. I'd been in this room 6 times over 3 days, and I'd noted on the second visit that the half-open door wasn't carelessness. Frank Doyle was 81, hip fracture, sustained falling off an 8-foot ladder while clearing a blocked gutter because, as he'd told Renee on admission without audible apology, nobody else was going to do it. He was sitting up against the raised headboard, pale blue eyes fixed on the doorway with the specific settled attention of someone who noticed everything entering a room. Not nervously, continuously. The water glass was on the linoleum, not broken, lying on its side. "Slipped," he said. "It does that." I picked up the glass, collected a towel from the cabinet, crouched to wipe the floor. He watched my hands, not the way most patients watched, passively, waiting for the room to return to quiet, but with the focused attention of someone measuring something, cataloging it for later. "You move quiet," he said, when I looked up. "For a person doing a job in the afternoon, most people make more noise than the work requires. Footsteps, cabinet doors, things set down harder than necessary. You don't." I stood. I refilled his glass. I wrapped the blood pressure cuff around his right arm and read the numbers. His eyes didn't leave my hands the entire time. "You're the student," he said. "Sadie Marlowe. Frank Doyle." He extended his right hand. I took it. His grip was completely wrong for an 81-year-old man 3 days post-fracture. Measured, controlled, specific in a way that had nothing to do with his current situation. Military firm, the particular grip of someone who'd learned to shake hands in a context where the quality of your grip communicated something real about you. I had the same grip. I was careful not to use it. "What branch?" I said, before I'd quite decided to. He raised one eyebrow slowly, and for the first time in 23 days at this hospital, I understood I'd just handed somebody the one piece of information I'd spent 3 years making sure nobody could ever find. He raised one eyebrow slowly. "You want to walk me through that?" I nodded at the scar along his jaw, narrow, puckered at one end, a specific pattern. Then at his free hand, resting near the bedrail without quite touching it, not holding it for stability, positioned near it. "Army," I said. "Infantry, not support. Korea, given your age." He regarded me for a moment, not surprised, just looking. 58th Infantry, 48 through 51, he said. "And then, your turn." "Just a nursing student," I said. He made a sound, short, dismissive, not of me, but of the answer. "Sure you are." I was almost to the door when he spoke again, quietly. "Whatever you're carrying," he said, "it shows in the way you stand, not the specifics, just that it's there." I stopped. My hand was on the door frame. I didn't turn around. "Have a good afternoon, Frank," I said. In the corridor, I stood with my back to the wall and counted my heartbeat until it was where I needed it. 58, 58, 58. When I came back to the nurse's station, Dr. Ellison was reviewing lab results. He didn't look up. "Room 2, supply cabinet, 4x4s are low. Before you leave today?" "Yes, sir," I said. The cabinet got restocked. Expiration dates checked on everything within reach. Thorough, quiet, unremarkable, in every visible way. The drive home was 40 minutes of dark county road. Dinner made, very little of it eaten. I sat at the kitchen table until the dishes were cold in the drying rack, right hand flat on the surface, the scar catching the overhead light, and I looked at it without making myself stop. Being ordinary had never been a natural quality. Performing it was something I'd gotten better at. That was all it was. I arrived the next morning at 6:15, an hour and 15 minutes before my shift. I sat in the parking lot for 8 minutes watching the first gray light come over the tree line, and then I went inside. Carol, the overnight nurse, looked up from the station desk when I came through the door, looked back at her chart, said nothing. This was the correct response. This was the kind of reception I'd calibrated myself to receive, and I operated best within it. I poured coffee in the lounge and went through the overnight charts without being asked. Mr. Garfield in room 8, oxygen saturation holding steady overnight. The post-surgical patient in room 4, doing well. Frank Doyle in room 7, blood pressure had elevated to 148/88 at 2 in the morning, back to normal range by 4. Carol had noted it, without calling Ellison. Call threshold was 160. She'd been right not to call, but the spike was worth watching today. I wrote it on my own notepad, the one I kept in my left scrub pocket, the one nobody asked about. Dr. Ellison arrived at 7:40. He reviewed the overnight summary without greeting anyone, scanned the morning board, and spoke without looking up. "Student. Supply count before rounds. Same form." "Yes, sir." The supply count took 40 minutes and covered every cabinet on the floor. I documented accurately and submitted the completed form to Renee at 8:20. She reviewed it, said nothing, handed it to Ellison. At 9:30, a woman named Eleanor Voss arrived with her daughter, 78 years old, confused since the previous evening, weakness in the legs. Not herself, the daughter said, and then she said it again. Very not herself. The specific type of repetition that meant the speaker knew they weren't conveying the full extent of what they meant and was hoping the repetition would close the gap. I was at the linen cart near the admission desk replacing pillowcases. I didn't stop my task. I listened to the daughter's account from 12 feet away, and I watched Eleanor walk across the waiting room floor. The gait was careful in the particular way of someone whose legs were doing something unpredictable and who had begun compensating before she fully understood she was doing it. She was holding her purse with both hands pressed tight against her body. I replaced 3 more pillowcases. Then I looked at her lips, then her fingernail beds. I went back to the pillowcases. Dr. Ellison assessed Eleanor, ordered a metabolic panel and urinalysis, standard first response for an undifferentiated presentation in a woman her age. I put the linen cart away and prepared Frank's scheduled medication and brought it to room 7. He was awake. He took the pill without comment, handed back the cup. "You were early this morning," he said. "I came in early," I said. He watched my face. "Couldn't sleep?" "I sleep fine." "I didn't ask if you slept. I asked if you could." I wrote the medication confirmation in the log. I checked his wristband against the label. I did everything in the correct sequence. 3 years, I said. Not an answer to anything he'd said recently. He waited. Since I left, I set the medication log on the tray table. 3 years. Hard exit or planned? I considered it. Planned, but not ready. I picked up the log. I'm always ready for the decisions I make. "That's not what ready means," he said, gently, not as a correction, as a distinction that mattered to him. I left before I had an answer. In the hallway, I heard Renee's voice carry from the nurse's station. "Sodium is 118, doctor." I stopped walking. A pause. Then Ellison, "You said 118. "Yes, sir." My hand went to the wall. I had no memory of doing it. 118. Severe hyponatremia. The careful walk. The grip on the purse. The confusion since the previous evening. The pale color at her lips in the waiting room light. It assembled in under 2 seconds. Clean and complete. The way a diagnosis assembles when you've seen enough of a particular picture to recognize it from a corner. What came next had a narrow margin. Rapid correction of severe hyponatremia caused osmotic demyelination syndrome. Irreversible neurological damage. The protocol was slow and precise. A controlled rise in serum sodium, no more than 6 to 8 milliequivalents per liter in any 24-hour period. It needed a specific fluid calculation, central line access, and someone to check that calculation against my own. My right hand was flat on the wall. I was aware of my own breathing. I was a nursing student. Ellison had 31 years in this building and a valid license and every professional authority this situation contained. I removed my hand from the wall. I walked back to the station and stood at the far end of the counter and watched him work through it. He ordered the correct fluid. He calculated the correction rate and it was appropriate. He was cautious, and he was, in fact, competent. And the plan he dictated was the plan I would have dictated, and everything was under control, and I was not needed. I stood at the counter. Renee looked at me from across the station, held the look for 1 second, looked away. At 2 that afternoon, I went back to room 7. Frank had a paperback on the blanket beside him. He put it face down when I came in. His eyes went to my face and stayed there. "The woman they admitted this morning," he said. "She going to be all right? How did you know about her?" He tapped the wall beside the headboard. "Old building, old ears." I wrapped the cuff around his arm. "Slightly elevated, same as yesterday." "The doctor is managing it correctly," I said. "That wasn't what I asked." "She's going to be fine. The protocol is appropriate, and it's underway." "Good." He watched me roll the cuff. "I had a company commander in Korea," he said. "Man named Briggs. No relation, different county entirely. He used to say the most dangerous thing you could do to a capable soldier was make them stand in the back of the room for too long." I clipped the chart to the board at the foot of the bed. "He wasn't talking about the soldier," Frank said. "He was talking about what happens to the room." I looked at him. He looked back. No urgency in it. the patience of someone who'd long since stopped spending energy on things that weren't worth the investment. Air Force, I said, quietly. Not the way I'd said it yesterday. A slip. A moment I hadn't quite managed. As a choice. Small. Deliberate. Like setting something down. Frank nodded once, not pressing for more. Thank you, he said. The way you say thank you when someone has given you something they weren't required to give. I left his room and stood in the hallway outside his door, and breathed in the antiseptic and old wax smell of the corridor, and did not move for a moment. The drive home took 40 minutes, same as always. I didn't turn on the radio, because the silence in the car was easier to sit inside than anything a stranger's voice might interrupt it with. Dinner made, barely touched, same pattern as most nights that month. I sat at the kitchen table until the room went dark around me, and didn't bother getting up to turn on a light. I thought about the word I'd given Frank that afternoon. Air Force. 2 syllables, and I'd handed them over like they cost nothing, though I knew exactly what they cost. It wasn't a slip. I'd made sure of that before I said it. But saying it on purpose didn't make it feel any less like standing at the edge of something I'd spent 3 years building a fence around. Sleep didn't come. Same as most nights. I lay in the dark doing the thing I always did instead. Running through equipment checklists that no longer applied to anything I did for a living, reciting supply inventories for gear I hadn't touched since 2021. It wasn't insomnia exactly. It was closer to a system that had never been told to power down, still cycling through readiness checks for a mission that was never going to be called. At 4 in the morning I gave up entirely, got dressed, and drove back into town in the dark. I sat in the hospital parking lot with the engine off and watched the building the way I used to watch a staging area before a call-out, waiting for something without knowing what. The next few days passed the way most of my days at Ridgeview did. Quiet, repetitive, structured around routines. Other people barely noticed, and I never stopped noticing. Frank continued healing on schedule, his hip stabilizing, his color better each morning. He told me small pieces of Korea in return for nothing. The cold that got into your boots and never fully left. A company commander named Briggs who used to say things Frank still quoted 40 years later like scripture. I didn't offer anything else about myself, and he didn't ask for more than I gave. It was an arrangement that suited both of us, built on the specific kind of trust that doesn't require full disclosure, only the certainty that neither person is going to push past what the other has decided to hand over. Dr. Ellison remained exactly what he'd always been. Student, this. Student, that. I answered every time. Same tone, same compliance, same quiet refusal to correct him. It cost me nothing to let him keep calling me that. It cost me nothing, or that's what I told myself standing at the supply cabinet at the end of another identical shift, checking expiration dates on 4x4s I'd already checked the day before. Eleanor Voss improved steadily on the corrected sodium protocol, her confusion clearing a little more each day, her daughter driving back from wherever she'd gone to sit with her longer than she probably needed to. I watched her chart from a distance the way I watched everything, cataloging the numbers without needing to act on them, and there was something almost peaceful in being able to just watch a good outcome unfold without having to be the one responsible for it. I kept arriving early, 6:15, 6:10, once at 5:50, each time telling myself it was about beating traffic on the county road, though there was no traffic on the county road at that hour. Not ever. Not once in 3 weeks. I sat in the lot and watched the sky lighten over the tree line. Gray first, then something closer to silver, then the specific pale gold that comes right before full daylight, but doesn't commit to it yet. On the morning that everything changed, I arrived at 6:15, same as most mornings that month, and sat in the lot for 8 minutes watching that same gray light settle over the same tree line. And there was nothing about that morning that told me it was any different from the 20 that had come before it. I finished my coffee. I went inside. The time. Carol looked up from the station desk, looked back down at her chart, said nothing, and I settled into the corner of the desk with the overnight charts the way I did every morning, and started reading. Mr. Garfield, stable. The post-surgical patient in room 4, stable. Frank Doyle, vitals within normal range overnight. No notation from Carol beyond the routine entries. I wrote nothing on my private notepad that morning, because there was nothing yet worth writing down. I was still at the station at 1347, filling out incident report forms nobody was going to read closely, when the sound reached me. Not consciously, not at first. A vibration below the threshold of the fluorescent hum, something that arrived through the soles of my feet before it reached the air around me. A low, synchronized pulse, the specific density of heavy diesel engines running in formation. My pen slowed on the form. I counted the intervals without deciding to. 3 vehicles minimum, possibly 4, moving fast and not decelerating. The pen went down on the desk. I stood and walked to the corridor window without hurrying, because hurrying was something you did after you'd confirmed what you were dealing with, not before. Through the glass, the small parking lot stretched out toward the county road, the low ridgeline of Blue Ridge pine beyond it, empty and gray in the early afternoon light, exactly the way it had looked every day for 3 weeks. Then I saw them, 3 shapes rounding the bend at the far end of the road, moving with a coordinated compression that had nothing to do with ordinary traffic. No lights, no sirens, nothing announcing themselves except the fact of their own approach. I stood at that window with my hand flat against the frame, and every system I'd spent 3 years telling myself was retired came back online in the space of a single breath. I turned from the window without running, because running was the second thing you did after confirming, and I still had steps to take before I got there. Renee was at the station charting something that no longer mattered. "Call Dr. Ellison," I said. "Now." She looked up, already starting to ask why they'd be coming here. "Call him. Tell him blast injuries, mass casualty protocol, number unknown, arrival under 90 seconds. She started to ask how I could possibly know that. "Call him," I said again, and I was already moving toward the supply room. Fresh gloves pulled on. I stood in front of the trauma cart for a moment, the specific layout of it, the way the supplies were organized, the exact reach of each section, and then took one step back, hands into my scrub pockets. Nursing student, present to observe and assist under supervision, back against the doorframe, waiting. The front doors came open 51 seconds later. 4 men came through them the way people come through doors who have done this in considerably worse conditions than a critical access hospital in Western Maryland. Large men moving in the synchronized compression of a unit that communicates in fractions rather than sentences, covered in the fine red-brown dust of a training range. They carried a litter, 2 men on each side. The man on it was alive, but not by a margin that could sustain itself without immediate intervention. The lead man wasn't the largest of the 4, but he was the one the room organized itself around without instruction. He came through the door with a single sweep of the space, floor plan, personnel, exits, equipment, all of it taken in before the doors had finished opening, maybe 40. A jaw like the end of something dense and durable. 3 days of beard coated in the same range dust as his boots. "Clear me a bay," he said, not loud, informational. "Chest decompression and femoral arterial control. Right side chest, left leg. Get your doctor now." Renee was already reaching for the phone. Ellison was already coming down the corridor, and he stopped when he registered the 4 men and the litter and the specific atmosphere that enters a room with people who've come from somewhere bad. "Bay 4 is open," I said. From the supply room doorway. Flat. No inflection. Not stepping forward. Information only. Ellison looked at me. Renee looked at me. The lead operator turned and looked at me. I kept my eyes on the patient. I'd been looking at him since the doors opened, building the picture as they moved through the room. The tourniquet on his left thigh was applied as high as anatomically possible, groin adjacent, meaning the injury was likely at or near the femoral origin. The windlass had been twisted past standard, meaning the field medic hadn't achieved adequate occlusion on the first pass, and had corrected forcefully. That tourniquet had been on long enough for the distal limb to show it. But the chest was what was killing him on the clock I was running in my head. Trachea deviated right, visible at this distance. Absent breath sounds on the left, confirmed by the way his chest moved unevenly from 10 feet away. Tension pneumothorax. The needle and the tube were the distance between this man and the end of the margin. I kept my hands in my pockets. Ellison directed the team toward Bay 4. The operators moved their patient with the efficiency of people who'd cleared their own paths in worse rooms than this one, and the lead man coordinated his team in quiet bursts of specific language as he moved. He swept the hallway again, the automatic sweep that doesn't stop until it's accounted for everything present. It reached the supply room doorway. It slowed. I was against the frame, hands in my pockets, eyes on the patient as the litter moved past me, not looking at him, doing the specific type of not looking that is indistinguishable from looking to anyone who knows how to read it. His sweep stopped. His team kept moving, his body kept moving with it, momentum carrying him forward, but his eyes stopped on me and didn't continue. They went to the scrubs 2 sizes too large, the short hair, the compact stillness of someone standing against a door frame in a crisis who isn't doing nothing but is choosing not to do something, and the distance between those two things is visible to exactly the people trained to see it. Something crossed his face that wasn't the expression of a man looking at a stranger. He took 2 more steps. His team went through the bay door. He stopped in the corridor with 6 feet of linoleum between himself and me. He opened his mouth. He didn't say my name. He said the other one. Angel. Not a call across a distance. A direct address, delivered at a normal speaking volume, to a specific person in a specific room, using a name that hadn't been spoken in my direction in 3 years and 4 months. The corridor went quiet. Renee's hand stopped on the crash cart. Ellison turned from the bay door. Through the bay window, the 3 other operators registered their team leader's position and followed the line of his attention to the doorframe where I stood. Nobody moved. Nobody spoke. I took my hands out of my pockets. The moment I did, something changed in the hallway. Not loudly, not dramatically. The specific atmospheric shift that happens when a person who's been choosing not to occupy a space steps into it fully, and every conscious person nearby registers it, even without naming it. "Excuse me," I said, not to Kessler, to Dr. Ellison, who was standing in the bay 4 doorway with one hand on the frame and his face carrying an expression somewhere between authority and the first edge of uncertainty. I moved past him without touching him, and he stepped aside without quite deciding to, the way people step aside for something that's already made the decision for them. Inside Bay 4, the 3 other operators had Kowalski positioned on the bay bed, litter removed, equipment arranged in the specific improvised order of men who know how to work in bad conditions and have done the best they could with good ones. His color had moved from bad to worse in the 90 seconds since they'd come through the doors. Tracheal deviation, still right, increasing. Blood pressure on the portable monitor, 79/44. Heart rate, 131 and climbing. Oxygen saturation, 81%. The chest would kill him before the leg did, and it would kill him in the next 4 minutes if nothing changed. I pulled gloves from the box on the crash cart without looking at it. The box was where I knew it would be. That cart had been inventoried on my 3rd day here and verified every morning since. "What is she doing?" Ellison said from the doorway. Not aggressive, genuinely uncertain. "Tension pneumothorax," I said, my voice flat and factual. "Needle decompression. Then tube. I need a 32 French chest tube tray and a Plurivac assembled. Renee." I said the charge nurse's name without looking away from Kowalski's chest. Renee didn't move immediately. "Renee." I said the name again. Same volume, different register. Low, absolute. The tray, now. Renee moved. Ellison stepped forward. "I am the attending physician. You are not authorized to touch this patient, sir." Kessler's voice from the doorway. Not raised, not aggressive, entirely final. "Step back." Ellison turned. He hadn't been told to step back in his own facility in 31 years of practice, and his face registered this fact completely. Kessler was looking at him with the level patience of someone who will wait exactly as long as necessary for the correct decision to be made, and not a second longer. Ellison stepped back. I was already at the patient. I found the second intercostal space on the right side at the mid-clavicular line. 2 fingers on the skin, confirming the anatomical landmark with the specific certainty of someone who's performed this in conditions that included darkness, moving vehicles, and active enemy fire, and has never had the luxury of getting it wrong. "Hold his shoulders," I said. One of the operators moved without being asked twice. His partner took the hips. They'd done this positioning before. I could see it in how immediately and how correctly they moved. I drove the needle in. The hiss of decompressing air was immediate, pressure-driven, escaping the catheter with enough force to confirm what I'd already assessed. I removed the needle, left the catheter in, taped it at the hub. The trachea shifted, visible at the anterior midline. Beginning. On the monitor, oxygen saturation climbing, heart rate starting down. "Tube tray," I said. Renee was already there. Sterile packaging open. 5th intercostal space, left side, anterior to the mid-axillary line. I made the incision. Fast and clean. Dark blood welled immediately. Scalpel down. forceps into the incision. The deliberate, ugly violence of tissue spreading, the procedure that looks like damage and is repair, the sight of which had caused Ellison, visible at the edge of my peripheral vision, to go very still. I swept one gloved finger into the space, the confirmation pass, clearing clots, verifying anatomy before the tube went in. Kowalski groaned, deep, guttural, the sound of a body remembering it's still fighting. "He's with us," one of the operators said quietly. I placed the chest tube, aimed posterior and superior, fed past the first resistance, then into position. Dark blood moved immediately through the tubing. I connected the plurivac. The machine engaged, pulling air and blood from the space that had been collapsing since the ordnance went off. "Sats," I said. The floor nurse at the monitor looked at the screen. 91, 92, 93. Heart rate, 114, 112. Blood pressure, 86/52 on the next reading. Not good, but moving in the right direction. "He needs surgery for the femoral," I said, stripping my gloves. I was looking at the tourniquet on his left thigh, high and tight, windlass past standard, applied by someone who knew what they were doing. "This stabilizes the chest long enough to transport. Femoral is compromised at the inguinal region. He needs a level 1 OR and a vascular surgeon within 45 minutes. What's your medevac ETA?" "Bird is 8 minutes out," Kessler said from the doorway. He had his radio in one hand. He was looking at me with an expression I didn't look at directly. "That's fine. Continuous vitals until touchdown. That tourniquet checked every 10 minutes. If SATs drop below 88 after the tube, call me." I looked at one of the operators. "You'll stay with him until the bird lands." "Yes, ma'am," he said, without hesitation, without irony. I walked out of Bay 4. The corridor was completely still. Renee at the station, Ellison against the wall, the 2 floor nurses frozen in the doorway to room 3. All of them looking at the woman in the blood-stained blue scrubs who just performed 2 advanced trauma procedures in under 5 minutes in a 12-bed critical access hospital and walked out of the bay the way you walk, out of a room where the work has already been done. Nobody spoke. I walked to the sluice room at the end of the corridor. The door opened on an elbow push, faucet on, hands under the water, scrubbing until the drain ran clear. The door opened 40 seconds later. Kessler came in the way. A large man enters a small room when he's conscious of its size, sideways, staying near the door, not advancing into the space. He smelled like range dust and the specific sweat of someone who'd been under operational stress since before noon. "Dispatch pulled your student registration when we were routing to the facility," he said. "Sadie Marlowe, Allegheny State, 3rd-year clinical rotation." I almost missed it. He paused. "You changed your name." "I didn't change it," I said, my eyes on the drain. "I used my mother's maiden name. I've always had both." "Angel." He said the call sign the same way he'd said it in the hallway. Not a question. The confirmation of something that had been waiting to be confirmed. 38th Rescue Squadron, Moody Air Force Base, PJ. 5 years active duty. Separated 2021. He paused. "You were the best combat rescue operator I ever saw work, and I've worked with a lot of them." The water ran. The drain was clear. I kept scrubbing. "We were running a joint exercise at Cedar Valley," Kessler said. "Live ordnance breach from an adjacent sector shouldn't have been possible, and was. Kowalski took frag to the chest and leg and was down inside 30 seconds. I had 2 options. Base hospital, 24 minutes. This facility, 12. Then dispatch flagged a name attached to a PJ service record, and I made the call. He let that settle. It was the right call. "You didn't know I'd step forward," I said. "No," he said, "I didn't." A pause. "But I know what a person looks like when they're making themselves stand in the back of the room. And I know what they look like when they stop." The water ran. I turned it off. I stood with my hands on the rim of the sink. "I left for a reason," I said. "I know the reason." "Then you know I can't." "I'm not here to recruit you," Kessler said. "I'm not asking you to re-enlist, recertify, or go back to anything. I'm telling you a fact and letting you do what you want with it." He was quiet for a moment. Jonah Pierce. The name landed in the room before I could prepare for it. It landed the way certain names land without permission, bypassing every defense, going directly to the place where the defense was built in the first place. I said nothing. The sink rim was cold under my hands. "He made it through everything," Kessler said. "After Kandahar, after the evac you coordinated, He recovered fully, finished his service, separated 2 years before you did. Kessler's voice was level, but there was something deliberate about the levelness, the specific control of someone delivering something that required care. He went civilian, became a wildland firefighter, hotshot crew in Montana. 8 months ago, a snag tree came down wrong during an evacuation operation. He was extracted but didn't survive transport. My hands tightened on the sink. 8 months ago, I'd been 40 minutes from this hospital in a classroom at Allegheny State, learning the proper procedure for documenting a routine medication pass. I'd been invisible and unreachable and exactly as protected from the world as I'd designed myself to be. And Jonah Pierce, who'd survived 2 combat deployments and a helicopter crash, and the specific kind of recovery that takes years and costs everything, had died in a Montana field, and I hadn't known, because I'd made myself the kind of person who couldn't be found, and being unfindable had been the point. I hadn't been there. He used to say I was terrible at pretending, I said. My voice wasn't steady. I didn't try to make it steady. He was right, Kessler said. He said it gently. He would have laughed at this. I gestured at the supply room door, the corridor beyond it, the blue scrubs, the mop, the invisibility routine. Probably. He always said I had the worst poker face he'd ever seen on a PJ. Kessler was quiet. I stood at the sink for a long moment. The antiseptic smell of the room, the drip of the faucet, the distant sound of the medevac helicopter beginning its descent to the hospital lot. I could feel it in the floor before I heard it properly. That same low vibration I'd felt 3 days ago from the convoy, and my body registered it with the same precise internal response before my mind caught up. I breathed in, I breathed out. Thank you, I said, for telling me. You didn't have to. No, he said, I didn't. He reached into his vest and set a card on the edge of the sink. Plain white, a single number in black ink. That's not a job offer, he said. It's a contact. People who speak the same language, if you ever want to talk. He paused at the door. Kowalski would have been dead before the bird landed. You know that. He left. I stood in the sluice room with the card on the sink edge for 3 minutes. Then I walked back into the hallway. Ellison was at the nurse's station. He looked up when I came out of the sluice room. He looked at my blood-stained scrubs, the dark spray across the front, the wrist-to-cuff staining, with an expression I hadn't seen on him before. Not diagnostic, not authoritative. Just a man registering what he was seeing and processing it against what he'd previously assumed. The needle decompression, he said. Second intercostal space, mid-clavicular line. Yes, sir. Correct placement. He wasn't asking. He was verifying something he'd watched. And the tube. Fifth space, anterior mid-axillary. Yes, sir. He looked at me for a long moment. The chart in his hand wasn't being read. He was looking at me with the specific expression of a man who's operated inside a fixed understanding of something for a long time and has just encountered information that requires him to rebuild it. What branch? He said. Air Force. Para rescue. He nodded once, looked down at his chart, wrote something, looked up again. We have spare scrubs in the supply room. Your size. He paused. You should replace those before the next shift. It wasn't an apology. It was nowhere near an apology. But it was the specific acknowledgement of a man who doesn't have the vocabulary for what he means and is saying the next available thing to it. I understood it, and I accepted it. Thank you, Dr. Ellison, I said. Supply room. Fresh scrubs from the shelf. My size. I stood in front of the mirror above the utility sink for a moment. The short hair, the pale green eyes that read gray under fluorescent light, the face 3 years of careful work had made unreadable. Jonah Pierce was dead. Frank had said whatever I was carrying showed in the way I stood. In, out, down the corridor to room 7. Frank was in bed with the overhead light off, and only the small reading lamp on, casting the room in a low amber that was different from every other afternoon I'd been in here. I noticed it before I cleared the doorway. He'd asked for less light, which sometimes meant pain, sometimes fatigue, and sometimes the specific economy of a person who started making decisions about what deserves their energy. You saved that boy, he said when I came in. His voice was quieter than yesterday. He's stable, I said. Medevac took him 40 minutes ago. He'll be in surgery by now. I heard the helicopter, he said. He was watching my face with the same attention as always, but the energy behind it was different, careful in a new way, as if he was measuring how much to say. You all right? I pulled his chart from the board. Afternoon vitals from Renee. Blood pressure elevated. Pulse with a notation beside it. Irregular rhythm noted. Query arrhythmia. Labs flagged for morning. I looked at the notation for a moment, then set the chart back. Someone I served with died 8 months ago, I said. I found out today. Frank said nothing. He didn't reach for a response. He understood what silence was for, which was one of the things I'd come to value about him over 3 weeks of short hallway conversations and afternoon vitals. I made myself unreachable, I said. I thought I was protecting people. I was hiding. I stopped. I missed it. His death. I missed the whole thing. Yes, Frank said, quietly. Not cruelly. Just accurately. I sat down in the chair beside his bed, something I'd never done before, had always stood, clipboard in hand, maintaining the professional geometry of student and patient. I sat without the clipboard. Frank closed his eyes. His breathing was even, but slower than it had been. His chest rose and fell with a deliberateness that was new. You're going to be all right, he said. Don't know that, I said. I do. He opened his eyes briefly. The pale blue, steady and direct. Good night, Sadie. I sat beside his bed until he was asleep. Then I walked back to the station and wrote up the day's incident forms and did not think about the card sitting on the edge of the sluice room sink. I thought about it anyway. The internal phone rang at 0217. I'd been at the nurse's station for 2 hours by then, having come in again before my shift, having told Carol I'd take the early hours, having been silently grateful when she accepted without asking why. I'd been filling in the overnight incident log and not sleeping, which wasn't a new condition, only a more honest one now. Carol picked up the phone, listened for 4 seconds, said, I'll get her, held it out. Room 7, she said. I walked the corridor without hurrying. It was the specific, unhurried pace of someone who's learned, through repetition in difficult places, that the speed of your approach changes nothing about what you find when you arrive. Frank's room was quiet. The reading lamp was off. Only the monitor glow. His breathing was audible from the doorway, shallow and rapid, with the labored quality of a respiratory system working against increased resistance. His color was off in the monitor light, pale at the lips and fingertips, a gray undertone to his cheeks that hadn't been there yesterday afternoon. I checked his pulse. Irregular. A fast, slow-fast pattern under my fingers that I recognized and that confirmed what the afternoon notation had flagged. I looked at the monitor display. The tracing showed the chaotic rhythm of new-onset atrial fibrillation, not the chronic managed kind, but the acute, destabilizing kind that in an 81-year-old man, 3 days post-hip fracture with an uncharted cardiac history, carried a specific category of risk. I reached for the phone. His hand closed on my wrist. Sadie, he said. I stopped. His grip was the same as always, measured, controlled, specific, weaker than yesterday in a way he hadn't tried to hide. I know what this is, he said. His voice was quiet, completely calm. I've been around long enough. Frank, I kept my hand on the phone. I'm calling for a transfer. They can manage the arrhythmia at a cardiac facility. It's manageable. Maybe, he said. He looked at me. Sit down first. I looked at him. I sat down. He was quiet for a moment, working through a breath that took longer than it should have. The monitor beeped its irregular rhythm. Outside the half-open window, the Blue Ridge darkness was absolute. No moon visible, only the very faint suggestion of the tree line against a slightly lighter sky. My daughter wanted to stay, he said. I sent her home because she was afraid. She loves me completely, but she was afraid of this. He moved his free hand slightly toward the monitor, the room, the specific situation. Afraid of being here when it got hard, and I couldn't have that in the room with me. You're not afraid of it, he said. Not a compliment. A fact he was stating because it was relevant. You've been in rooms like this before. Not this room, but this situation. Someone who needs to be accompanied through the hard thing. He paused for a breath. You know how to be present for the hard thing. That's rarer than people think. I'm afraid, I said. I'm afraid right now. Not of this, he said. Not of being with someone when there's nothing to fix. You can sit with that. Most people can't. His hand tightened slightly on my wrist. Not urgent. Just there. Stay a minute. I took his hand in both of mine and I stayed. His breathing was slow. The monitor displayed the arrhythmia in its wavering green line. Irregular, but not yet in a configuration that meant immediate collapse. He had time, not a lot of it, and not the kind that stretched forward without end, but enough for what he was using it for. My CO in Korea, he said. Briggs. The other one, not me. Different county entirely. He used to tell us that the bravest thing a soldier could do wasn't charge a hill or hold a position, a long breath. He said it was to stay with someone even when there was nothing left to do, even when staying didn't change the outcome. A pause. He said staying was its own kind of valor. He was right, I said. Yes, Frank said. His voice was quieter now. He usually was. The pale blue eyes in the monitor glow, still sharp, still seeing. You're going to be fine, Sadie Marlowe. You don't know that. I know what a broken person looks like, he said. I've been looking at them for 81 years. You're not broken. A breath. You're just carrying something heavy. There's a difference. The monitor tone shifted at 0304. Not a flat alarm. A sustained single note, low and steady, replacing the irregular rhythm that had been there before. I looked at the screen, the monitor tone, Frank's face, the stillness that had settled across both. My hand stayed in his. I sat in the chair beside Frank Doyle in the low glow of the monitor and held his hand and breathed and did not look away from any of it. 7 minutes. Then I stood. I smoothed the blanket at his side. A moment at the foot of his bed, looking at the man who had seen me clearly in a building full of people who hadn't bothered to look. At the nurse's station, I wrote the time in the log. 0304. 0304. S. I called Renee's overnight emergency line and reported the death in clear clinical language, and I listened to her response, and I said I would remain on site until the morning shift. Then I stood in the corridor outside room 7's door and looked at the darkness inside. Jonah Pierce had died in a Montana field I'd never seen, and I hadn't known. I'd been invisible and unreachable by design, and my design had cost me the chance to grieve him with the people who knew what he'd been. Frank Doyle had died in a room I'd mopped myself 3 weeks ago, and I'd been present. I'd held his hand. He'd known someone was there. I couldn't have one. I'd been given the other. The mathematics of that sat in my chest like something lodged. I walked to the sluice room. Kessler's card was on the edge of the sink where he'd left it 8 hours ago, untouched until now. I picked it up and stood under the fluorescent light and looked at it. Plain white, one number in black ink, the weight of it nothing. The weight of what it represented, something I didn't yet have the words for. Into the scrub pocket. Back to the nurse's station, corner chair, clipboard and incident forms and the fluorescent hum above me. The lesson I'd been running from for 3 years and 4 months was this. You cannot save everyone. There is no version of enough that ensures it. People die in fields you never see, in moments you're not present for, on tables where your hands can't reach. Some of that is distance. Some of it is time. Some of it is the simple, irreducible fact of being one person in a world that doesn't pause to accommodate that limit. The not knowing isn't failure. It's what it is to be human and finite and unable to be everywhere at once. But you can show up for the people in front of you. You can take your hands out of your pockets. You can sit in a chair beside someone at 2 in the dark and hold their hand and refuse to look away from the hard thing. You can walk into a trauma bay and do the work your hands know how to do. You can let someone see you, the real version, not the performed one, and trust that it won't destroy you. All of that had happened today. Kowalski, alive somewhere in a Baltimore operating room because I'd stepped forward. Frank, not alone when it mattered because I'd sat in that chair. Not the fixed version of heroism, not the version with lights and running and shouted commands. The other version, quieter, harder, the refusal to look away. The morning shift arrived at 6:30. I gave handoff to the arriving nurse, thorough, specific, each patient by room number and current status. Then I gathered my bag and my clipboard and walked the corridor toward the exit. I stopped at the supply room door. I looked in at the mop in the closet, the shelves I'd inventoried, the supply carts I'd restocked, the corner in the back where Ellison had pointed his finger 6 weeks ago without looking at my face. I closed the door. I walked on. In the parking lot, the morning air was cold and tasted like pine resin in elevation. My car sat under the broken light post where I'd parked it on day 1, because that spot was at the edge of the lot, furthest from the entrance, least visible. The habit of a person who'd spent a long time choosing the position least likely to draw attention. I stood beside the car and looked up at the hospital. 12 beds, one attending physician. The window of room 7, dark now, curtain drawn. I pulled Kessler's card from my scrub pocket, looked at it in the early light. The number in black ink, the plain white background. Go back to Allegheny. Complete the clinical hours, submit the paperwork, become a civilian nurse in a civilian building. Invisible until I died, and skilled enough at the performance by now that it might even hold. Or I could figure out what came next for a person who was both things simultaneously. The one trained in darkness to pull people out of fire, and the one who'd spent 3 years trying to wash that off in a hospital sink and discovered that it didn't wash off, and had stopped trying. There was no good version of this day. Frank Doyle was gone. Jonah Pierce had been gone for 8 months, and I hadn't known. Those two facts sat in my chest at the same weight, and they were going to sit there for a long time, and I wasn't going to pretend otherwise. But Kowalski was alive, and Frank hadn't been alone, and I hadn't looked away. The sun came over the Blue Ridge ridgeline as I stood there, the specific slow appearance of it above the hills, the way the light spread across the parking lot gravel and the hospital wall and the dark window of room 7, all of it simultaneously, indifferent and complete and making no distinctions. I looked at the card one more time. The card stayed between my fingers. Not put away, not set down. Held the way you hold something you haven't yet decided what to do with, which is different from something you intend to put down. I drove out of the parking lot and onto the county road. The road ran east toward the morning light. The hills opened up on either side, the Blue Ridge spreading wide and green and permanent, and the sky above them was the specific pale gold of very early day, the kind that doesn't promise anything but doesn't take anything away either. I drove into it.